So there's been a real shift in the last decade away from antibiotics, and what was happening was the idea was, wow, if I get sick, I'll get an antibiotic and I'll be better and all will be good with the world. But it turns out that several things were going on. One is it was disrupting the normal bacteria within the body, particularly in the GI tract, and so it just disrupted that whole normal flora. Because that bacteria, there are millions and millions of bacteria that live and carry out normal functions. They were getting destroyed. And then the second part was we were creating these resistant bugs. So if you had 1,000 bacteria sitting there and 999 of them are susceptible to the antibiotic you choose, but one's not, you knock off the rest of the guys and then this one guy just takes over. And so what happens then is we were going through antibiotics and needing much more complicated, higher level antibiotics to treat simple infections that used to be, susceptible to things like penicillin and the like. But the more we used antibiotics, the more we were seeing resistance. So most of the major hospitals now have an antibiotic stewardship program where you're starting to look at antibiotics to decide, do you really need that antibiotic? How soon can you stop it? And then as soon as you find out that it's susceptible to a lesser intense antibiotic, you switch them over to that. Probably the biggest shift for parents has been around treating ear infections. So in the past, your kid with a little fever, cold, go in, people would go in and they'd look and they'd see that he had a red ear and the child would get put on an antibiotic. Now we've come to the realization that most of those infections are viruses, probably 85% of them. So the antibiotic is just a waste of money and it just increases now the complications. So a big move right now is for parents to bring their child in. They'll think they've got an ear infection, and then they'll just say, all right, we're just gonna tough it out, just treat the fever, just keep them comfortable, keep up fluids, but not use the antibiotic. And that's been a big shift. And we're hoping what that'll do is to allow for a kind of emergence of less resistant bacteria. Because in a hospital, when we have patients that are critically ill, a resistant bacteria can be a disaster. It's just really complicated. You have to use very high-end antibiotics, and you pray that they don't develop resistance to that antibiotic as well.